Hi, my name is Carla and I am going to be performing the deep tendon reflex assessment. Okay. This is my model and she is about 18 years of age. She has already filled out the release form and we've already posted that in Canvas. Okay. So, I'm going to go ahead and knock, knock, knock. Hi, my name is Carla and I'm going to be performing deep tendon reflex on you. I will perform hand hygiene. I will don gloves. I'm going to confirm my patient's identity with 2 identifiers, and then also I will explain the procedure and introduce myself. So my name is Carla, and can I have your name and date of birth?
Miranda, September 4th, 01.
Great. Okay, so I'm going to go ahead and be performing the deep tendon assessment. What the deep tendon assessment does is it allows for the staff to recognize risk factors related to preeclampsia or eclampsia. This is just another word for high blood pressure during pregnancy. The risk for seizure during pregnancy with extremely high blood pressure is cause for concern. And a lot of times patients will receive magnesium sulfate, which is used to treat preeclampsia. That also is a central nervous system depressant. And so the assessment of the deep tendons does 2 things. It allows us to assess the risk for preeclampsia, and also the treatment of make sure and confirm that you are within normal limits within the treatment of magnesium sulfate as well. Okay. The way that you document and you measure it is you assess on a scale from 0 to 4. 0 is absent. 1 plus is hypo-responsive. You have 2, which is normal. Then you have 3, which is hyper-responsive. And then you have 4, which is the highest, and that's clonus. That's it's a very serious matter, and that's something would need to be done immediately to intervene and notify the doctor. Okay, so what I'm going to go ahead and do is I'm going to go ahead and perform first the bicep one, and 2, which is here in the antecubital section. It's just at the bottom base of the bicep, and if you have a hard time finding the tendon, a really nice way to locate that is ask the patient to go ahead and flex for you. There we go, flex. And you can actually feel the tendon here. It's like a taut rubber band, and it's just here in this area. So what you want to do is once you find that tendon, you want to go ahead and have the patient relax their arm, place your thumb over that tendon, okay? And then relax. And then you're going to use the tip of your hammer. Raise the elbow. There we go. That's better. Use the tip of your hammer, and it's just a nice, brisk, fast tap on your thumb, and it should have elicit a reflex from this area here, a response. Okay? So, ready? Here we go. Okay? Okay. That was good. That would be a normal response, which I would document as a 2+. Okay, then after that, we're going to go ahead and do a bicep. Now we're going to do a tricep. And what you do is you extend the arm here, okay, and you allow the patient to dangle the arm nice, carefree, and loosely. And where you're going to locate that tendon is here at the elbow, okay, and you can feel it. If you use your fingers here, you can feel, like I said, that tendon, that rubber band. So I'm right-handed, so I'm just going to switch here. Okay. Hey. And then what you're looking for is you're looking for a response here. You're looking for an extension in the arm. Okay. Okay. And you'll go ahead and use the back of the hammer. There we go. Okay, good. Okay, the next one we're going to do is the patellar, which is right here, just below the kneecap here. The tendons are located here. You're going to have the patient's leg dangling. Okay, nice, loose. what you're gonna see is you're gonna see an extension of the leg, and that's the response that you're looking for. You can locate the tendon by feeling the kneecap, and it's just below the kneecap, and you can feel, as I said, that rubber band or that taut tendon here, okay? Are you ready? Here we go. Okay, relax. Good. Okay. Okay, then what I'm going to go ahead and do is I'm going to do the Achilles heel. And let's see. Here we go. We can do it. Let's go ahead and do it. Let's have you lay down here. Okay. If you don't mind, I'm going to have you lay down on this side, okay? Okay. I'm right-handed, and it's just a little easier to control my hand with my right hand. Okay, so for this one, I'm going to have the patient lay down on their back. Okay, I'm going to go ahead and bend at the knee and bring the leg up here so that it's nice and relaxed, okay? The Achilles tendon is here just above the heel. And then what you want to do is you want to go ahead and dorsiflex, okay? Which means that you just want to get that tendon tight. You can feel it here, okay? And then what I'm going to do is I'm going to use the hammer. Let's see, I'll use the back of the hammer for this one. Okay, and what you're going to see is you're just going to see plantar flexion, okay? Okay, a little bit, okay. Woo, there we go, it's right there. Okay, then the last thing I'm gonna go ahead and do is I'm gonna go ahead and do its clonus reflex. And what a normal response is going, what the procedure is, what the process is I'm gonna go ahead and reflex or do dorsiflex, plantar, and then dorsiflex. And it's just a quick, like that. And this would be a normal response. The foot is still, it's not shaking. Is there any pain involved? No pain is involved, okay? So that would be a normal response. An abnormal finding would be when you go ahead and dorsi, the patient's foot will have a rhythmic movement like this, plantar and dorsi, back and forth. Okay, that's what it would be. It would just go back and forth in a rhythmic way like this. That would actually be a abnormal finding, and the nurse would be concerned with seizure. Okay, so after that, thank you, I'm all done. So after that, what I'm gonna do is I'm gonna go ahead and make sure my patient has no questions. I'm gonna perform hand hygiene, take off my gloves. That involves taking off my gloves and washing my hands. And I'm gonna go ahead and position my patient in a safe and comfortable way, and then document. Thank you.